Welcome back to another review class for our practitioners from the Philippines. Okay, so we are very fortunate to have with us Sir Mark Anthony Panlilio of Santa Maria, Bulacan from the Philippines. Join us. So I'll call you later, Sir Mark. I'd like you
Opo.
to comment on the cases if you want. So
Opo.
we will be showing you. So earlier we discussed Lung Yin deficiency. So this time, let's take a look at. Okay. So let's focus on. Do you see this? Automatically, you would know, right? Depression. So this patient, 32-year-old male, complained of runny nose, sneezing fits, tightness of the chest, cough, occasional difficult breathing, tendency to catch colds. So Western diagnosis, allergic rhinitis, allergic asthma. Okay, background, family history of allergies. Wow, opera singer. Oh, diba? Overuse of voice. Okay, I love opera. Okay. Overworking, irregular eating habits. Okay. So yun. Okay, so the tongue is pale red. So that's a normal color, diba? It's swollen, no? With teeth marks. So if it is swollen, there is dampness. So when there is dampness, the spleen has something to do with it. So you have spleen chi deficiency. Okay? Why do we not call this spleen yin deficiency? You don't see any cracks. Remember our lecture on spleen yin deficiency? You don't see any cracks on the side, right? Yeah. So this is spleen chi deficiency with accumulation of dampness. Now the depression on the anterior third, that's gathering chi deficiency and lung chi deficiency. Remember, the tongue is not red. Yes? Next, this time we have an older patient, 56, female, dry throat, dry cough, tendency to catch colds, constipation, sorry, insomnia. Remember, constipation, there's too much heat because the lung and the large intestine, they are the metal element. Remember, there's insomnia, exhaustion. Western diagnosis, prolapse of the uterus. So when you have prolapse, uterine prolapse, think of deficiency, right? Spleen, chi sinking, remember? Okay. So spleen and the lungs, they have a very, they belong to Tai Yin. Okay. Background to disease, overwork, lack of sleep. Okay. Description of the tongue, pale, slight teeth marks. So what does this mean? Teeth marks, spleen chi deficiency. Pale and thin. The tongue looks thin. Do you agree? That's blood deficiency. And then the depression on the anterior third, hmm, deficiency of gathering qi and lang qi. So most likely in the in eventually this patient will have hoarseness, right? Slight reddening of the tip. Did you notice the slight reddening here? So there is slight heat in the heart. Hmm? And then the coating, yellow, thin, greasy coating. So there is slight because the coating is thin. It's not very thick. It's yellow and thin. Yellow means heat, no? Greasy means damp. Okay? So slight damp heat in the lower burner. Okay? Next, we have a 65-year-old male. Symptoms, pressure and fullness in the chest, shortness of breath upon exertion, intense thirst. So there's a lot of heat. As you can see, do you see the posterior third? Yeah. Mm. And the tongue is red. Pain during urination, back and abdominal pain. Western diagnosis, coronary heart disease, kidney stones, type 2 diabetes. Okay, sometimes they have all the all the problems in the world. So how I wish someday the doctors will realize how important we are, no? In as a what's this? Um, as a partner. Background to disease, smoking for 35 years. Okay. Heavy physical labor. So physical kidney, yin deficiency. Okay. Uh, the tongue is reddish and the edges are curled up. So if the edges are curled up, the liver area, there is liver qi constraint and there is spleen qi deficiency because um, if the liver qi is constrained, that means the liver qi is not moving. Okay, so this will impact the spleen. So there will be slight. That's why you can also see the teeth marks. No, vertical crack in the anterior third. This one, you see this? Hmm. You will usually see two, but sometimes they're like parallel. Okay, so if you see those cracks, this one is very near the heart, right? Lung and heart yin deficiency. And then yellow, thick, dry coating at the lower burner, right? So there is damp heat in the lower burner. Okay. Next, 41-year-old male, dry cough, pain in the chest, stomach pain, difficulty sleeping, tendency to develop high fevers, irritability. Western diagnosis, acne vulgaris, but he's too old to have acne. Okay. Background to disease, abuse of nicotine, black tea, cannabis, irregular lifestyle, frequent viral and bacterial infections with high fevers. The tongue is slightly thin. So if you see a thin tongue, that's blood deficiency, and there is we see a crack here, slight blood and yin deficiency. So the edges are curled up, slightly red. So liver qi constraint with heat in the liver because in comparison with the other slide, no, the edges here are slightly red. So there is liver qi constraint with heat in the liver. Cracks in the anterior third, lung yin deficiency with heat in the lung. Then the coating at the posterior, at the lower burner, they're not really that thick. But it's yellow, greasy coating. So there is slight damp heat in the lower burner. Next, we have a 58-year-old female, frequent colds with cough, shortness of breath. The lower legs are swollen, dizziness, intense inner feeling of cold. So Western diagnosis, lower leg edema, chronic bronchitis. Make sense? Kidney, lung, spleen. Background to disease. For years, her work required that she stands and overwork. So the tongue is pale red, very swollen. Hmm? If the sides, no? So that means there is underlying. If you take a look closely here, you can see the depression um, the of the back, no? So it forms a letter V. So that means there is weak kidneys. So here we have a kidney yang deficiency, accumulation of dampness in the middle and upper burners. Okay. Now swollen, dry, and cracked in the anterior third and center of the tongue. So there is blockage of lung qi due to accumulation of dampness, blockage of water pathways, so the onset of lung yin deficiency. Next, we have a 28-year-old female, chronic cough with profuse white and slightly yellow mucus, nasal congestion, dry throat, exhaustion, mood swings. Western diagnosis, chronic sinusitis, chronic bronchitis, very common. But if you ask further, there is repressed emotions, excessive spicy food consumption. So the tongue is pale red with pale edges. So that is spleen qi deficiency with blood deficiency, pale. Deep horizontal cracks in the center and the anterior third, stomach and lung yin deficiency. No coating. Slight swelling in the anterior third, So there is phlegm. So if there is swelling of the anterior third, no, this is not depression, this is swelling. That's phlegm. Okay. So there is phlegm retention in the lung. And later on, if the tongue turns red, for now it's still pale red. If it becomes red, so you have phlegm heat. Okay. Red in the anterior third, heat in the upper burner. Okay. Only in the upper burner. The rest of the tongue is pink. Okay. And dry, so deficiency of fluids. The last one, younger patient, do you like his tongue? Chronic dry cough, dry mouth. So I wanted to focus first here, anterior third. Thirst, inability to fall asleep. Western diagnosis, chronic bronchitis. Cigarette smoking for many years, irregular lifestyle. That's why the tongue is very dry, no? So the tongue is pale, red and thin, pale red thin. So spleen chi deficiency with slight blood deficiency. Small irregular cracks in the anterior third. Onset of Lung Yin deficiency. Yellow dry coating without root. So when you say without root, um, it's like it's like you just put a carpet there. It did not grow from under the floor, no? So there is onset of kidney deficiency with retention of dumpy. That explains why you have a very dry coating. Okay. Now let's go to assessment. Sir Mark, are you ready?
Yes, Doc.
Okay. Of course, we only have 10 questions, and of course, all the questions will be about the tongue. Okay. What do swellings or growths of the mouth indicate? If you see a
Kapag may swelling,
yeah,
kapag may swelling po nag-uusapan po, Doc, is talk about meron po itong phlegm, damp, and toxins po.
very good. Have you seen that on your patients?
Yes po, Doc, nakikita ko po ito.
Nabukol-bukol. Okay.
Bukol-bukol siya.
What are the three things we look at in the sublingual veins? Oh, this is
Ah,
yeah. Do you always look at the sublinguals?
yes po, Doc, tumitingin po ako niyan, Doc eh.
Okay. So ano yung three things na tinitingnan natin?
Titignan ko po dyan sa sublingual niya po, yung length, yung haba, yung kulay, yung color, tsaka yung shape po.
Okay. So normally, if the patient doesn't have so much health issue, you don't really notice the sublinguals, no?
Yes.
Color, the shape. Okay. Ano to? You have to tell me if it's normal, if it's blood stasis or genetic. That means you inherited it. Sublingual veins that are slightly raised, slender, payat siya, with slight purple color, no branches or static spots.
Kapag no branches, tsaka walang mga bukol-bukol static spots po, normal po ito, Doc.
Very good. Number 4, sublingual veins that are thick, makapal. Blue
Yes.
purple, purple red, crimson purple, purple black, with dark red or purple net-like small vessels. May mga branching, tapos parang may mga kanin-kanin. Bead-like purple
Yes.
nodules. Ano to?
Doc, pag mga ganyan mga pasyente ko, lahat ng stroke ko, ganyan po, Doc eh. Meron po itong blood stasis po, Doc.
Wow. Kinukuha mo ng picture yung ano mo. Yeah, blood
Apo,
stains.
before and after po kami.
Very good. Sublingual veins, qualities on one side of the tongue. One side. Ano ibig sabihin nun?
Pag one size po ng dila po, meron po itong blood stasis on one side of the body po.
So what is the possibility? What is possible to happen? Ano ba nagkukos ng stroke? Diba?
Ang stroke, overwork,
Kulang sa flow ng dugo doon, no? So, kaya nga
kulang sa dugo.
mm. Sublingual, so ibig sabihin, we can already tell, um, that is if the patient will believe you, to actually continue the treatments. That's why you need to show your patient his tongue. Everyone has cell phones now. Di ba?
Yes, Doc. Ano yan, Doc? Pinipicturean ko po before and after. Tapos ina-analysis ko yung shape, textures, tapos yung sublingual nga, titignan ko yung kulay kung may spots or yung ano niya, yung heart and lungs niya. Titignan ko mabuti kung anong diferensya, saan yung magiging root of cases ng pagkakaroon ng stroke niya. Kung may wind ba o wind hit, anong sanhi? Doon na malalaman, Doc eh.
Hmm. Yeah, very good. Okay, what about if the sublingual veins appear tied? Parang tinali.
Parang tinali po, Doc, ito po yung genetic effect po.
Okay, there's nothing you can do about it. You inherited it. Veins
Wala
should
tayong
be what color?
Dapat po sa ano po, Doc, is pale red po tayo.
Okay. Okay. If you see the veins vis clearly, or the veins are clearly visible, ano siya, normal or pathological?
Doc, pathological.
Okay. What do sublingual veins signify? Bakit natin tinitingnan ang sublinguals?
Tinitignan natin dun, Doc, kung meron po itong blood stasis, before rest of tongue becomes purple po, Doc. Tinitignan po natin to kung merong yung dugo na hindi dumadalo bago po ito maging kulay purple talaga, Doc.
Okay. Have you seen cases like that na hindi pa purple ang tongue pero very prominent na yung sublinguals, no?
Yes, Doc. Nakita ko yun po yung sa ilalim ng dila.
Okay. And lastly, okay, what if yung sublingual veins are distended, medyo mataba siya, pero hindi siya dark. So that means hindi siya blood stasis, right? So what is the
Yes po.
diagnosis?
Na-diagnose ko po ito, meron po itong Yin Deficiency and stagnations po, Doc.
Of course, kung kulang sa chi, hindi gumagalaw yung chi.
At stagnation.
Wow, thank you so much,
Sige
Sir
po.
Mark. I really admire your wit, your brilliance. Thank you so much. And thank you
Salamat
everyone for joining.